Hey everybody, it's Dr. Brace here for Facial Plastics Friday. Today I just wanted to update everyone on what's going on with COVID. You may have heard that the Ministry of Health put out an announcement on Wednesday that all elective surgery was to be stopped. We're still waiting to hear from our college, our regulatory body, on what that means for private surgical centers. And so if you do have surgery scheduled with us, we will let you know what's happening. But otherwise, only urgent and kind of emergent surgeries are happening at the hospitals for sure right now. But besides that, let's talk about scars today. And so a lot of questions come in from pretty much every surgical patient on how long will it take for my scar to look good. And what we tell everybody, what the literature tells us, is that it takes a year for a scar to fully mature. So a fully mature scar is one that is thin, flat, and has lost its pigment or its redness. So you want it to be kind of white or skin colored, flat and narrow. And that's what a mature scar looks like. So if you've had a facelift, your scars are going to take a year to fully fade away. That being said, they tend to look pretty good around 3 months where they're just lightly pink. There are things that we can do to make scars look better quicker. People often ask about aloe and vitamin E and other scar creams. And really the evidence for scar creams out there is all with silicone. And so silicone containing scar gels are the ones that have the most evidence for flattening scars and taking redness out. If you do want to use vitamin E or aloe or Mederma or any of the other over-the-counter products, there's no harm from doing that, and they certainly encourage you to massage the scar, which helps. And so those are good adjuvant things to do. The other thing that we offer is pulse dye laser. Pulse dye laser, as I've told you guys before, is a red laser. It's absorbed by hemoglobin and it can help fade scars quicker. And so all of our cosmetic patients get complimentary pulse dye laser scar treatments to help them fade quicker, flatten quicker, and go away. One thing I did want to mention about scars as we're coming into the nicer weather is sun precautions. There is a phenomenon called post-inflammatory hyperpigmentation, or PIH. If you have a fresh scar and it's under a year old and you tan it or burn it, it can pick up a bunch of brown pigment and make it look wider and darker than it really is. And that can be really distressing if it happens. And so if you're going to be out there and you have a fresh scar this year and it's going to be nice this weekend and into the summer, make sure you have your SPF 30 or above on. Reapply it if you're sweating, or at least every 3 or 4 hours, and make sure you have a hat on to protect your scars by giving some shade, and stay in the shade if you can. So send us your scar questions, send us any questions you have about facial plastic surgery, and